This is Quarterpast 65, our podcast where we talk about different issues concerning those who are 65 years and over. We're talking about health issues. We're talking about various wellness issues. We're talking about the thank you that they get or didn't get from all the contributions that they've made to society and how they move on with life generally. I'm your host, Dr. Stella Dorgu. You're welcome again to the program. Today we're going to have a great conversation with somebody who will tell us about the psychological, emotional challenges and disturbances.
Our guest today is Dr. Olufumilayo Akiola. She's the Director of Clinical Services at the Yaba Psychiatric Hospital. You're welcome to the program.
Thank you very much, ma. It's an honor to be here.
Yes, thank you. Well, let us take it from the beginning.
Okay.
Who is a psychiatrist? What is psychiatric medicine?
Okay, so a psychiatrist basically is someone that has been trained as a medical doctor.
Yes.
So you now have your specialization in the field of psychiatry. So when we talk about psychiatry, we talk about all the processes that are involved with our mental processes, our emotions, psychological, emotional, and of course behavior. Because we know that when we talk about psychiatry, we talk about the way we think, our thoughts, processes, the attitude that we put to things around us, emotions, and ultimately how we behave. So all processes, everything that can affect all that I have said encompasses what we mean by psychiatry. So anything that has to do with our mind, with our brain, and ultimately show up as a behavioral manifestation. So that's what we mean when we talk about psychiatry. So that's what a psychiatrist deals with.
All of these things emanate from our worldview, perhaps?
Well, a lot of things, you know. It has to do with our brain. It has to do with our brain. So, and you know, when we talk about life, we talk about the nurture, your genetic
component, nurture and nature.
And the environment. So all these come together to form a human being, somebody's attitude. All you see, you know, modeling from your home, where you are raised, the things you pick up in school, and the society where you work and all that. So, you know, we talk about culture too. All these have effects on how we eventually behave and all the mental processes.
And who's to say that the way that I behave has become is normal or is not normal or is abnormal? Who's to say?
Well, I want us to look at it from maybe two different perspectives. Number one, so when we talk about something is normal or abnormal, before we can even say somebody's behavior or activity is abnormal, we're going to look at that individual in all areas of life, like the three spheres. We talk about home, we talk about either the person is a student or a worker, so school, occupation, and in the community where the person lives. So is that, you know, when WHO defines mental health, it says mental health is the ability to be able to realize your abilities, the things you can do, to be able to cope with stresses of life, to be able to function in your community, contribute to your community. And of course, we know that there's a higher being up there, have a relationship with a higher being. So that's the definition. So it's not just the absence of mental illness, it's the definition of well-being, in which you are able to cope with life, cope with stressors, you are well, you are fine, you are functioning. So when people stop functioning, so that's when we begin to raise an eyelid. What's going on here? You find a young man, 30 in his 40s, and all he does is sit on the balcony of his house all day long. He gets there in the morning and he sits, doesn't do anything. I mean, is that individual functioning?
No.
So we must function in the family where we are. We function in the either school or occupational space, school, occupation, in the community where we live. How do we behave in the church, in the mosque, in the marketplace? You know, you want to buy something from the market woman. Some can be so nasty, and you wonder, is my money that I want to spend? Why are you behaving like this? And you enter some other people's shop, they're so warm, even when you do not like it, but because of the reception they give you,
You're able to.
Yeah.
Yes.
So we talk about personality disorders too. How do you relate? People get to church and everybody will like, she has come. Get to the mosque, nobody wants to sit with you. So you see that it's all more about functioning in the three spheres of life. How are you able to cope with life? Are you able to plan? I want to do this, I want to accomplish this, and you get it done. Maybe not 100%, but at least you make effort. Then can you think to plan? Then your relationship with others, which is so important because nobody's an island. God created us to be social beings. We're supposed to interact with others. So there are some people that they just can't interact. They were not always like that. Maybe somewhere along the line, something happened. So when we see all this, so we look at people holistically. We just don't take one thing and say that they have
Mental health. When we look at the elderly,
Yes.
and our concern is about the elderly,
Yes.
because we know that by the year 2030, there are going to be more of us.
Hopefully.
Hopefully.
Yes.
Hopefully.
In this part of the world.
But can we cope? What are some of those things that make it impossible for the elderly to continue to function? And if I may,
Yeah.
we're looking at depression leading to dementia, they say. There's Alzheimer's, there's schizophrenia.
Well, I think I want to believe that the main thing, the problem, main issues with the elderly right now is because of the way the social construct is going in Nigeria culturally. Things are changing because now when you have children, they are grown. They don't stay with you anymore. They are outside the country. They have jackpot to UK, Canada, and all that. So you see many people being on their own. Who is taking care of them? I remember like maybe 2, 3, 4 years ago when I went back to where I grew up, and I went, to that area. I stayed in an hotel and I just took a drive. All the houses that we used to go to when I was young, all the houses are empty and quiet. Because I'm sure all the children there, they're outside the country. So it's either you take your parents with you, and most fathers won't want to go. And the mothers, if they go, they'll come back. So there's a shift in things. So those that don't have children, or there are some people that their children don't ask them to come and stay with them wherever they are in developed countries. So they are left to them. There's nobody taking care of them.
Is that enough to cause
It is
dementia?
enough. It's not dementia. So there are different categories. Like I talked about emotion. So we have a mood disorder. That's depression. The commonest part of a mood disorder. Commonest part of a mood disorder is depression. Then when we talk about dementia, so we are talking about structural things, damage going on in the brain.
In the brain.
Yes. And the commonest example of that is Alzheimer's dementia. So that's, you see that's another spectrum. So we have the minor occurring psychiatric illnesses, which depression is the commonest. We have the psychotic one, which although we talk about skis, but it's not, because it's just 1% of the population anywhere in the world. So it's not that common.
How do we know these things? If a parent is having dementia, if a parent is depressed, how do you know? How do they present, and what can be done?
Okay, so I think one of the most important symptoms in identifying if there's a problem, psychologically, emotional, is change in behavior. So for somebody that is depressed, of course, the person will be number one. It could be you see that there's a change in the mood, the change in the way. Somebody I had a client that he was a
A
bubbly type.
gregarious person. Yeah.
Go to the palace with the king, they make decisions. Now he did not want to go anywhere. So that is it. No mood. They'll say they are tired. And you've slept for 8 hours and you wake up in the morning and say you're
And still
tired.
tired.
Then the things they love to do, they used to love to do, they do not want to do it anymore. So they rather stay in one place. And what do they do there? They begin to think. We talk about rumination, things that happened to them in the past. And they will sit down there for hours, they won't even know the day is practically gone. So then they won't eat well, they lose a lot of weight, they don't want to talk to anybody, they don't want to pick their calls. So the number one thing is once you notice change in behavior, but don't go diagnosing everybody, but just let's be on the lookout. So what's going on? If you are calling your parents and your parent is not picking the call, 1 day, 2 days, you go there, they don't want to eat. The person that used to love to eat now is like, oh, put it in the freezer, I'll get back to it. An alarm should start going on, withdrawing to self. So the children should not leave them alone. Keep on going. What is wrong with you? Daddy, but I've noticed, or mommy, you didn't go out. Did you go to church? Did you go to the mosque? No.
So you're talking about the need for a relationship.
Yeah.
What if there was no relationship in the first place?
And that's what is happening now because the children are no longer around. So most times you get a carer. The carer is concerned about the money they're going to get. So are they really looking after your parents? So what can you do? You're not here. You do more of FaceTime. If you still have friends that are here, let them check on your parents. Let them go. So, but these are the symptoms of depression. Then what are the symptoms of dementia? They begin to forget things. They start losing their way inside the house.
They would have their sneakers with them and they're looking for it.
I remember I went somewhere one day. I went to the church and it was my son's godfather. And it wasn't a service, I think it was a Saturday. And as I was coming out, he was coming in. Very accomplished man, well trained and all that. And I noticed that as he came out of his car, entered his shoe was unbuckled. And I was like, this is very strange. It's not like now that people wear anything. These are people that are
proper.
When you say somebody is proper. So there's no way under the sun he would leave his house without buckling his sandal. I said there's something wrong. And the next time I saw him in the hospital. He already had dementia. So lose their way in the house. They can start getting angry because they can't remember things. So in order to fill those gaps, so when you ask them, but mommy, you remember that 2 years ago you came to spend Christmas with me? They can't remember. They'll get angry. What are you talking about?
So those are some of the things that you do when the person comes, because you talk about rehabilitation, bringing the person back.
Yeah.
So
not maybe for a depressed person, but for something like dementia, what we do is because it's a chronic progressive illness. So what we do usually is to slow down the progress.
How do you do that?
Yeah, so we do that with medication, start early, stimulation, depending on the stage where they are. So we give them things. Nutrition.
One of
around them.
Yes, one of the things that people are afraid of.
Yeah.
When it comes to
Dementia.
Psychiatrists or dementia, is that you pelt your patients with drugs.
No.
And it makes them get worse.
No.
And they now
true.
end up looking like zombies.
That's not true.
Is that what you're talking about when you talk about rehabilitation?
Okay. No, that's not what we're talking about. So where are you going to rehabilitate them? In their home, where there's nobody to take care of them? So you want to take them to the hospital where you can rehabilitate them. So, there are different diagnoses. So it's not one treatment, one management for all.
It's not a one size fits all.
No. So we can't, we must be careful not to lump it together. Okay? So for somebody that has dementia, Parkinson. I mean, you just make sure that you have a safe place to stay, because as it progresses, they start losing their way in their own home. So what do? You do not allow them to go out alone, because they can go out and they go missing, and you might never find them. And people see them, they'll say they are crazy, whereas they are not crazy.
This is a great place
Do you
for us to
understand?
have a break. You stopped at a wonderful place talking about dementia
Okay.
and talking about how old people get lost. I have some friends whose husbands, brothers, uncles, sisters have been found because they roamed far from home. And unfortunately, dementia is that age old or illness about the aged, about the senior citizens, that is misunderstood.
Yeah.
And people call them all kinds of things. They're witches, they're things. How will they not be called witches when they leave Abuja and come to Lagos or are found in Ilaro? They are dirty, there's no money, and then they just see a corn seller or they see bread and they pick it and run, and somebody is saying ole ole. How do we deal with it?
Okay. So,
Is our country able to deal with it?
yes, I think the issue with us in this nation is we do not like to readily accept that things can go wrong, that people can be ill, and if they're ill, it's not some demonic causes or spiritual or whatever. So it could be a medical cause. So once you notice, they'll say, it's expensive to go to the hospital and all that. You can't sit in your house and say something is expensive when you have not even attended. So the issue is, we all know when there's something wrong.
But the
But
access, ma'am,
no,
people do not have access
It is,
because it's not free.
well, it is not all that are actually very expensive either. For example, you come, you notice that your mom or your dad that was a businessman cannot recognize bills anymore. Cannot recognize that this is 1,000, this is 500. Or wants to go to the restroom, ends up in the kitchen, and she'll go and wee there. And you will still keep her. You don't know that something might be going on with her. Then her children comes, her neighbors, her grandchildren, and she can really recognize them. Who is this? Who are you? Who sent you? This, remember I said the most common, the most significant symptom is change in behavior. So let's keep them at home. Let's take them. Even make that attempt to go to the clinic, to the hospital first. See, psychiatry is now, the federal government has made it a lot better. So you have like standalone psychiatric hospitals. All the teaching hospitals, practically all the teaching hospitals in the country have psychiatric departments. So most federal medical centers have psychiatric departments. State hospitals too, they have psychiatric units. So
are you doing a lot of advocacy? Are you doing sensitization so that people will know that these things exist?
Well, I work in psychiatric hospital here in Yaba. So we do advocacy. We used to have a committee that was community outreach. We used to go into the community. We are going to revive that again now. Then right now we have Yaba Voice. I think third Thursday in the month, we have Yaba Voice, where we educate people, we tell them what to do, where they can find us.
Where do you find them? Do you go to the
No, we do it, it's online.
Okay.
So people...
but how much of our population, the older population, are online? I shouldn't be asking that question.
No.
Because Quarterpast 65
it's a pertinent question. I think it's important. So one other issue is that, yes, when we do advocacy, we go to the radio, we go to the TV, we do all that. If you have to go and talk, you have to pay. So the hospital has to pay. So, but on the other hand, because they are getting more aware of what we do. So when they have their medical day, they have days like mental health day, World Health Day, HIV day, and all that. They call us, so we go and talk. So when they call us, we won't have to pay. So that is one area that I think maybe the government can come in so that we can talk. But we're going to revive that community outreach committee of the hospital. So we go into mostly where you can find women. We go to the motor car park. We go to the hospitals, the women and the children section, because once you train a woman, you should know that she's going to tell others. She's not going to keep it to herself. Okay, so
she will do the usual amebo thing.
Yeah, she will talk about it. That, do you know who I met at the clinic today? They talked about it. So it's important. A child that has seizure disorder, you don't keep them in the house. Put their, then the elderly. Sometimes they even say that when they start having this dementia, sometimes they're having subtle seizures too. A lot of research has talked about that. So I think the most important thing is that we should stop keeping people that we genuinely know deep inside our heart that there's something wrong with them. Don't keep them in the house. Take them to the hospital. It's not that expensive until it gets worse. So somebody that has dementia, they also have behavioral manifestation. Remember, I said that they don't remember things. So in order for them to fill in those gaps, they start making up stories, just to make it up. And they know that there's something wrong, but they can't articulate it and tell you. So they get angry, they get irritated. So they lash out at their significant other, the person that is taking care of. Yes. So you said we dull them with medication. We have to deal with that. So if somebody is aggressive, will not eat, is always lashing out at you, we need to give something. So the point is, that is a wrong notion about the way we treat psychiatric illnesses, because they come in, they are so bad. So we give drugs, medication. It is expected that when they get well,
it would help to modify.
We don't treat and say go away. You have to keep coming to clinic. Why? So that when you come to clinic, we see that you are getting better. So that high dose, maybe we gave 20 milligram, we will reduce it. So we keep reducing it until we get to the lowest minimum effective dose. But most people will not come back to clinic once you discharge them. So they will continue at that 20 milligram that we should have reduced when they get to well,
5 or 1
or to 2.5. I had the patient once, elderly man. He was well. He should have come to clinic. His children should have brought him, but they didn't. Weeks later, the medication, the man that was shouting, that was pulling down everything, he was now dull. So he wanted to fall down. I said, please don't put me in trouble. Why did you go away? That is the essence of continually coming to clinic for follow-up. So I just reduced the medication and he came back.
A different person.
Yeah.
2 things that I want us to talk about. What if they don't have a caregiver?
So that's
what if there's no relation? What if there's no caring neighbor? How do we deal with these things?
That's social welfare. But we know now that the president of our nation started renewed hope agenda 2023, and one of the aspects of that renewed hope is the social welfare. So it's talking about women and the elderly. So I think now we need to do more of this advocacy for those that do not have, like I said, most people's children are outside the country. So we need to have elderly homes.
I was going to talk about that.
Yes.
That's my next question.
Yes. So we need to
elderly home something that we should think about in Nigeria.
We do.
It used to be a taboo. When I was going to school, just down the road from my school was an old people's home.
Are they taking care of them then?
They were not taking care of them then. This I'm talking about the early 60s. Is it different? Are you suggesting that we should have more homes
I
that
think
would
so.
care for the elderly?
I think so. Because what are we going to do? Are we just going
Because
to leave
the
them in the
children
house?
have jackpot.
They have jackpot. There's nobody there. You hear all sorts of stories. You hear that carers that will keep loading the elderly father or mother with medication until they die, and they keep collecting money from the children outside the country. So I think what we lack basically in Nigeria is regulation, supervision. So these elderly homes, we're not just going to, and it's not, you see, when you talk about supervision and to monitor what people are doing, it's not with you having punitive measures in mind. And we're just going to shut you down. We're going to, no, that's not the point. To go there, how are you? What are the things that you need to make this place to function? Not that we're going to shut you down if you don't do this, if you don't do that. And that's why people are, it's the
Leery.
attitude. Yeah.
So, because you know that the nursing home is
Mhm.
seen as a place of the ultimate abandonment for the elderly.
We really need to look into it. Either ways, we are going to get there. But the important thing is supervision. What are they doing there? And people should be qualified, at least trained minimally to work there. And you don't just employ anybody. We must get people that have empathy. They are compassionate. Because if you don't have these emotions, what are you doing there? Not because of the money that you can get. Because everything in life is not about money. So I think we just need to regulate these places. But we are there. There's so many. I mean, there was a day I was going home from work from Oshodi. We have an annex in Oshodi. And I saw two elderly women. And they were picking, there's a wall. The road, there's a wall to, I can't remember the name of the company. And they were picking things. They were looking at plants. I thought to myself, are they thinking this is vegetable or what? Elderly, those women, well, because maybe poverty made them very old, but they looked really old, two of them. And my heart just broke. Are you telling me that these two women don't have children? They
And
don't
what
have
did you do?
grandchildren.
What did you do?
I didn't pick them up because I don't know. If I talk
If
to them,
you, as
where would I put them?
as a medical doctor and a psychiatrist at that, who understands all these,
I'm not saying they were ill.
No,
it's
no,
just
no,
that
no,
it's
no.
a social aspect.
I mean, this okay.
I think it was social. No, they were dressed. But the point is, what were they doing outside without a young person with them? Well, you never can tell if they were ill until you assess them anyway. So, but they didn't look, unkempt. No, they were not unkempt. But the point was, what were they doing? It's like, what's the Yoruba word? Come on, what were they doing? Don't they have a home? Is nobody taking care of them? So this is the social aspect of old age. So we have to have elderly people's home. But people should be well trained. People should, supervision that things are done properly, not with the face that you're going to punish them, but that you ensure, there are two to
But
ensure that
you are
things are
saying
done
now that
properly.
it looks like our government is beginning to come to grips with the fact that they are not doing enough for the elderly.
I think
that they should begin
at
to
least
do
they have
more.
started. There's an agenda that social welfare that has included the elderly. So I think we need to do more of advocacy to the government so that they actually know where the needs are, so that they can come in and help. So it's not just to put the agenda there. We need to let them know what the needs are. I think maybe the wife of the president is involved. So if we can get people that know and let her know what is going on,
And then the other thing also is you're talking about those people who have to deal with the elderly.
Yes.
They too need to be taken care of.
Yeah. Because it can be tedious taking care of elderly people that have turned to children.
I know.
And their demands.
Yes, and their demands.
So,
but at the same time, they must do it with love and
empathy.
And empathy.
Yes.
And empathy.
Yes.
So, you are going to we're going to talk about how they cope, how to cope with the huge emotional toll that these older people bring on them,
To the carers.
to the carers.
Yeah.
We have gone into the area of the kinds of things that caregivers, those who care, should understand about older people in taking care of them. We've talked about mood swings. I even have an example of an older person who has hallucinations, and I think they call it bonnet syndrome.
That's the eye.
That's the eye, where they make up and see children, they see people. Can't you see them? In Yoruba, I know they say, oh, my leg Benny, she's seen all kinds of at that age. Well, because they say maybe they've regressed. How does a carer deal
So that is why
with all of those things? What do you do to give counsel to carers?
you can't take care of them alone without coming to the professionals. So, and before I forget, I want to encourage the government to, so when you have old people's homes, I think government should come in and fund them. Then you can be able to have oversight functions, supervise,
and then
all
there should
that.
be a standard, a minimum standard.
Then these carers should be trained. You know,
Yes.
if they are trained and you are told that what should, because if your client now is saying, I can see children, can't you see? You know, the tendency is for me to become afraid
Yes.
that there are some things inside this house, so I don't want to work anymore.
Yes. Yes.
For those that are we are a
Yes.
set of superstitious
Yes.
people
Yes.
in Africa. We just believe all sorts. I mean, then the child or the carer to might start saying, I'm hearing something. But if you have gone to the clinic, to the professionals, they would have taught the carer that, look, this is part of the symptomatology. When mama says this, don't mind her. But usually when they have people that are caring around them, all these symptoms tend to regress. I've had a client before, she had only one child that had jackpot, and they sold her house and all that stuff. So when they got a new house for her, she was the only person there with a lot of guarding. The carer will go to work, come back in the evening, left her at home alone. Of course, she started hearing voices of people that were not there. She said, they will come in, they will touch her head. She was lonely. She was just lonely. All they need, and I tell people, you can't have elderly people and keep them alone. They will think, then that thinking things will start happening. And all they need is just somebody. I just had a client recently, and she was admitted, gave her a carer for her only. When she got to where she was supposed to go, she said she wasn't going, because she came from old people's home. She's not going back to that place, so because I can imagine how many patients to one carer. But this one, she had one person to herself in the hotel, one-on-one. They sat there, they were gisting, talking. What does an elderly person want?
So that there's
somebody just all the things they did when they were young. All they want is somebody to talk to. That's all. And somebody that's listening to them. It's time to eat. If they can still walk, take a walk. Even if it's inside the compound. What then? Eat, sleep, pray. What is there to do?
And they also engage. Yeah. There's also the need for connection. That's what you've been talking about.
Connection. So somebody that they can talk to. And maybe their children start doing FaceTime, let the grandchildren then come visit. Even if they can't travel again because of the cold weather, come and visit them. Yes, Nigeria is good. Yes. So we will not be kidnapped.
By the grace of God and by the dedication and commitment of our security.
Yes. So all we need is connection, because we are social beings. I've had so many elderly people that are treated You know, a woman that had 3 daughters, they were married, they left her. She was educated. She was a midwife, a nurse. Compound, the clinic she had when she was younger. Of course, she started hearing things and seeing all sorts because she was the only one there. So I had to tell the daughter, you have to take your mother to wherever you are. You want to come put her in old people's home. As of that time, we didn't even have as many old people's home that we have now. So we need to be conscious of our elderly people, take care of them. Just all they need is mama, somebody to talk to. Mommy, tell me what you used to do when you were in your 20s and your 30s, and you'll be amazed at what you will learn,
and not
the
only
history.
The old people's home, people are talking about adopt a grandmother, adopt a grand aunt, those kinds of.
So even I had a client that when she got to the old people's home, she found out that she was better than some people. So she adopted some old people. She started taking, which was good for her.
Because again, these are upping people's skills.
Yeah.
Upping your networking.
Yes.
Using the things that you were used to doing
yes.
before, and see how you can
help
that
all the people that
in your different community.
So I mean,
it's been wonderful talking to you. I know that we could talk
on and on,
but now we do know that psychiatry is
so don't fear it.
It's a huge field.
Yes,
and it's not only for
those that walk naked on the streets,
or those that walk naked on the streets, but that when old people have been properly observed at home, they can be referred to you, and then you will do your own evaluation.
And the carers will be taught what to do, what not to do, and I mean, it's
so that life expectancy can also increase, and there'll be better well-being. Thank you very much for spending this time to talk to us on 65.